Today we're going to talk about bowel elimination and what that means for your patients. So this is the poop lesson. Now I know we've covered a lot of information in the urinary elimination lesson, so go check that one out when we're talking about elimination, but this one focuses really on the bowel. And I want to reiterate some important points from that lesson in here. Anytime our patient deals with bathroom issues, we really want to focus on, again, dignity and safety. We want to provide them privacy, and we want to promote safety by reducing the risk of infection, right? So what happens is you'll get some skin breakdown, some issues with maybe some leaky stool here. So this is where we really want to focus on the safety. The other thing we want to focus on is bowel output. So we want to measure our patient's stool and find out how often they're actually going. You're going to have to label it and measure it and do all that stuff. Make sure you're keeping tabs on it so we can make sure that their bowels are continue to work. Always check for a color, quality, and consistency. We'll talk about that a little bit later with different types of ostomies. But what you need to remember is that, hey, there are certain times where a patient doesn't have any sort of bowel surgery, and that color, quality, and consistency are all really important there. Also, make sure you know the difference between stool softeners and laxative. Stool softeners soften the stool, and stool softener is something like Colace. A laxative makes them go. So this is going to be something like Miralax. One final tip is always, if you have a concern with your patient's stool, how often they're going, if there's a problem with the device, anything like that, call your provider. Don't wait. We don't want any more problems for our patient than we actually have to. Just like with our urinary elimination aids, bowel elimination aids are pretty much the same stuff. You've got your bedside toilet. These are great for your ambulatory patients. If they've got some independence and they can get up and they're not a fall risk, or they're at a higher risk for falling, just make sure that you do like a safety sweep. Make sure they're not going to trip over anything. Make sure that all your lines are long enough. Make sure all your monitor lines are long enough and all your wires and all that stuff. Just make sure that they can safely get up, use the toilet. You're going to give them some independence by doing this. The other one here is going to be your bedpan. You've got your regular bedpan, your fracture bedpan. Your fracture bedpans are for your ortho patients. So your patients, if they have pelvic fractures, for most part, your regular bedpan is going to be fine. But again, if they have that ortho injury, they're not going to be able to place that same amount of pressure directly in a bedpan. So make sure, or on a bedpan. So make sure that you have something like a fracture bedpan. Always remember, again, you want to measure your patient's output when they go. Now let's look at some internal aids. I have a picture of a Foley here, but the type of devices that we use to contain the stool for our patients are really similar. And it's a tube connected to a drainage bag, and it's inserted into the rectum. There's some key points that I want to bring up. If your patient has a firm stool, you cannot use these. The stool won't pass through the tube. It's going to create blockages. It's going to create constipation. If your patient has a liquid stool, this is your huckleberry. This is what you want to use, especially if you have a concern for C. diff or Clostridium difficile, which is the GI infection. This is perfect for them. You always want to make sure that you're checking your patient's skin. You want to make sure that they're not leaking around the tube. They're not getting any skin breakdown. But this is, this is where the safety and the skincare come in. So just make sure that you're always checking your patient's skincare around the tube or whatever device you're using. You can't use these after rectal surgery. These devices really aren't for patients that have just had recent rectal surgery, so make sure your patient is good for it. If they've had a recent rectal surgery, this is contraindicated. The two types of tubes that you're going to need probably are something called a Malacot, which looks something like this. So it looks kind of like a Foley, except it's got these like weird looking prongs. It's all silicone, but what happens is it'll go in there and there's holes here and the stool will just leak. I say leak, it will just pass through this tube and into the drainage bag. The other one is called a FlexiSeal. This is a brand name, but it's much like this. It's got the tube and it has this balloon on the end of it and it's open. and you fill this with water. But the principles are the same. You want to make sure that it's the appropriate type of stool. If you're running any risk for infection, you want to make sure that you're checking your skin care, and you also want to use these when appropriate. I've had poop that's been running off the side of the bed onto the floor. Yeah, it's really gross, but these guys saved the day for sure. Now, the last thing I want to talk about are types of bowel surgeries. Now, ostomies are just like a general term for talking about creating a bowel opening through the abdomen at different levels of the entire intestinal system. Patients are gonna need them for like a variety of reasons, but there are a few things that you need to know about ostomies. And the first is its location is going to tell you what kind of stool you're going to have. So it's where we talked about color, quality, and consistency. This is what I'm talking about. This is where it's going to change. For instance, if you have an ileostomy, it's going to occur in like the right upper quadrant to the right lower quadrant. I've seen them vary, but they're going to be kind of in this lower mid to right side, and they resect the ileum, bring it up to the ostomy, and give you an ileostomy pad. For those patients, you're going to have yellow liquid stool, and that is normal. Versus your colostomy, that's at the descending colon, it's going to be firm, and it's going to be brown. That's what you can expect. The important part is that you need to basically, what does it look like? Where is it coming from? Do these make sense? Those are the things you need to think about. The other important part that I want to really touch on is this guy. So your stomach care. You need to have a good understanding of stomach care so that you can pass this on to your patient. Your patients are going to go home with this, and they're going to be able to have to know how to take care of it and what's normal, what doesn't look normal. First off, beefy red is normal. It should also be slightly raised, and that's normal. If it's protruding, that's bad. Call the provider, get in there to the bedside, have them do something called a reduction. Well, most of the time they'll do something called a reduction, which is basically where they push it back in. But that is totally patient dependent. It depends on the situation. That's what I've seen, but protruding is not normal. The other thing is if it looks dusky, that is a bad sign. It shouldn't be dusky. It should be beefy red. It shouldn't be blue. If it's dusky or blue, then that means the tissue is not getting the right perfusion. So we need to call the provider and get them to check it out. You also want to monitor for output and regularity, and start talking to your patients about the stomach care. This is where you start introducing to these concepts. If they know about them early, then they can have better outcomes. Also, call your WOCN, wound ostomy care nurses. Most hospitals have them, and these guys are fantastic. They're going to do a lot of your education. They can, re-educate you. They can help fill your gaps in knowledge. They are all things ostomy. So make sure that you get in touch with them so that you can actually help everybody out. Today, we really focused our nursing concepts on elimination and functional ability. And also, again, we were focusing on driving home safety by reducing infection. So let's recap. Your patient is not going to always be able to eliminate on their own. So make sure that they have the right device and make sure that it's staying clean for your catheter care. So this would be your Flexi Seal or your Malacot or whatever device they have. Make sure that these things are clean and you're reducing risk of infection. External devices, again, try to get your patient to use a bedpan, or you want to use your bedside. You want to give them autonomy, give them privacy, give them dignity. All of these things promote positive patient outcomes. If your patient has to have an internal device, make sure you're using the right one and only use them when you have to. Take them out as soon as possible. Surgical interventions really are a last resort, but sometimes they're necessary. So just make sure you know where the ostomy is, what kind of output you're expecting, and then let your doctor or the provider know if you have any sort of concerns. If the change is concerning, don't delay in getting in touch with them. That's it for our lesson on bowel elimination. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.